and welcome. You're watching NDTV. I'm Rishika Barua. India has crossed 4 million cases of the coronavirus, adding the last 1 million in just the last 13 days, the fastest million in the world. Joining me is Dr Randeep Guleria, the director of the All India Institute of Medical Sciences. Appreciate you very much, doctor, for sparing the time of day and being with us. I have to begin by asking you, India crosses 4 million COVID-19 cases, the fastest million in the world. When will India flatten the curve?
So the cases are going to increase for some time, after which I think we will be able to flatten or get the cases down. What we saw in the beginning was that the pandemic was limited only to larger cities, as the infection and the virus had come from outside, and there was a lot of urban crowding, or there were urban slums. But now the infection has gradually spread to smaller cities and has gone to rural parts also, and that is accounting for the increasing number of cases. It will take some time for this to stabilize, and then we should be able to see a flattening or a downward trend as far as the curve is concerned. The numbers look big, but if you start looking at it per million population, then they are not that frightening as they look if you look at the absolute numbers.
All right. Now, even as the COVID-19 infection graph is rising in the country, the virus in India is less fatal. The mortality due to the disease seems to be on the decline. Is the virus then, Dr. Guleria, losing its virulence?
So this is a question which a lot of people have been asking, that why is it that in India and in Southeast Asia the mortality is low? We have a very low mortality as compared to what was seen in Spain, Italy, or in New York. And there are various theories for that. The most accepted one, of course, is that we are a younger population, and it's well known that at a younger age group the mortality is much lower. Also, there may be some inherent immunity because some other types of coronaviruses have been circulating in this part of the world, and there may be some cross immunity which we may get from past mild infection with another strain of coronavirus, which just leads to a flu-like syndrome. But there is also this theory that the virus may have changed to survive, because if the virus was to have a very serious or fatal disease, then its survival in mankind would be not be that much possible. And a milder disease can spread more rapidly. So it's possible the virus is also changing, but we don't have much data to support it.
But, just to go back to the numbers, are India's numbers worrying to you? At this rate, it is anticipated that we would have crossed 6.5 million by the 30th of September. We're only 72,000 cases behind Brazil, which is reporting, 40,000 cases daily. Do India's numbers at this moment worry you?
So it is a cause of concern, and that's mainly because of two things. One is, if the numbers go up and we don't act aggressively, it may cause some strain as far as the health resources are concerned,
right,
and the need for the hospital beds and other things may actually increase. But also the reason why it's a cause of concern is that we are now moving into a stage where I say there is actually a COVID behavior fatigue setting in. And a lot of people have sort of moved away from that aggressive physical distancing, mask wearing or hand washing that they were doing 2-3 months ago when there was a lot of concern and when we had our lockdown.
Right.
Now, as the lockdown has opened, there is actually a bigger need for people to be more vigilant in terms of all of this. But that is not happening. And we are moving into the festive season. And with all of this, there is a huge concern that the cases may further increase.
All right. So, of course, you voiced your concern regarding the festive season earlier as well. I have to ask you, do you believe that there are certain states, certain parts of the country that are seeing a second wave now? In certain areas, one had believed that the peak is over, the virus is under control. For Delhi, for instance, Maharashtra, for instance, and rural proliferation, something that you've talked about in the past as well.
So that is possible. I think in many areas we're seeing a rising trend, resurgence of cases. You could call it a second wave. And again, it's related to 2 or 3 factors which I've already mentioned. And unless we become more vigilant, unless we become more aggressive in infection control practices and in a lot of testing, tracking and isolation, these cases will continue to rise. And this is the reason why there is a little bit of a cause of concern.
You're talking about testing, tracking, isolation. The ICMR has now revised testing guidelines and has allowed testing on demand. Dr. Guleria, who, according to you, should get tested?
So initially there was a lot of problem. We started off with very few tests. Now we're doing a huge number of tests per day. And because of that, we have the capacity to test people on demand. But obviously, those people who have some flu-like symptoms or who have come in contact with an individual who was COVID positive and they worry that they may have got the infection and are symptomatic or are asymptomatic but have had a close contact can get themselves tested. Initially, it was a big problem because you had to go to a doctor, you had to get a prescription, and then only could you get yourself tested. This is making things easy for people who want to get themselves tested. And I think this will be a big step in trying to really pick up more people who are infected, be able to isolate them so that they don't spread the infection to others.
Do you believe this is crucial to contain India's numbers, or do you anticipate now with testing on demand that the numbers will further rise before they come down?
Yes, so as your testing goes up, as you start doing more and more testing, you will obviously pick up more cases. So your numbers will go up. But I think that's a good thing because if you are able to pick up more positive cases, you then can act. You can act in isolating them, you can act in treating them early so that they don't get serious disease, and you can take a lot of measures so that the cases can subsequently be contained. But there will be an initial rise in the number of cases.
All right, so one can anticipate a further rise in the daily spike, but the high number of antigen tests versus RT-PCR, has raised concerns of whether we're actually under-reporting numbers.
So, as far as the rapid antigen test is concerned, it's important to understand that it's a good test when your viral load is good in the upper airways. So when you are symptomatic or you are in the pre-symptomatic stage. But if you get it done in people who are asymptomatic, it may be false negative. So what I would really say is that if you have symptoms, if your rapid antigen test is negative, you must get an RT-PCR test done. It's not enough just to get the rapid antigen test done. The advantage of the rapid antigen test is that in containment zones or in areas where you have a large number of people who may be positive, this test allows you to test people very quickly. You get a result in 15 minutes, you can isolate them. And in that area, there is a high chance that many of them have active infection and can be picked up early.
So very crucial, because you've reiterated this in the past, that if you're symptomatic and you test negative in the antigen test, it's imperative that you follow it up with an RT-PCR. Let's talk about the Unlock 4 guidelines, Dr. Guleria. How safe is it to travel by metro, rail? A lot of our viewers have sent in this question, and what precautions must they follow?
So again, as the economy opens up, like I said, we have to become more and more vigilant. So if you're traveling in the metro, three things you have to be very careful about. One is that you must always wear your mask and see that everyone else is wearing a mask. If both individuals are wearing the mask, the chance of infection becomes very, very low. Secondly, physical distancing. Try and maintain as much physical distancing as you can. If you have a very crowded metro, take the next one. Don't hop onto one where it's very jam-packed. And I'm sure measures will be taken in place to make sure that that doesn't happen. And secondly, hand sanitizer. Carry your hand sanitizer. If you touch the surfaces of the metro, if you touch the metro bar or the door, hand sanitize your hand. And while traveling, avoid touching your face with your hand, so that even if your hand is contaminated, the virus doesn't move from the hand to your face and to your nose and mouth.
So 6 feet distance essentially important while you travel in the metro as well. Whether that's going to be practically possible or not, of course, is a whole different question. But bars are also all set to open up. Is it safe to go to a bar? Is it safe to dine out? When you're eating and drinking, you have to, for instance, put your mask down. Doesn't that pose as a huge health risk?
Correct. So if you can avoid going to restaurants and bars, I think you should do that, because especially in places like Delhi, when there's an increasing number of cases, and in the country also the number of cases are increasing. It's better to have a takeaway rather than eating inside a restaurant or a bar. You will have to put your mask down while you're eating. It is sometimes the food is being served by the people who you're not sure how well they've been tested. And therefore it is a little bit of a risk. So if you are going to a bar or a restaurant, you have to take all the precautions that I mentioned. But the safest thing would be to have a takeaway and eat at home.
Well, safest, of course, to stay at home. Is it safe to socialize this festive season? You've warned about the festive season and the possibility of it bringing a fresh spike in cases. And of course, there are guidelines, when it comes to places of worship, for instance. But what happens to people celebrating festivals at home or having large gatherings at home? What are the kind of rules and regulations that they must follow?
So first of all, you must limit the number of people as much as possible. You can have a social function where you can socialize using various means, either FaceTime or through your various electronic media.
Yes.
But physically, try and minimize it as much as possible. If you still have to do a function, better to do it outdoor rather than indoor, because in an outdoor environment, because of the air, the chance of infection becomes less. If it's a crowded indoor environment, then because of droplet infection and surfaces getting infected, the chances of infection actually go up. And finally, like I said, try and maintain physical distancing, wear your mask as frequently as possible. Don't bring it down while talking, because people have a habit when they start talking, they get push
Yes.
their mask down. So try and avoid that. And like I said, keep the numbers as minimum as possible.
But I'll once again reiterate, Dr. Guleria, rules for gatherings at home. Do you believe that come the festive season, perhaps there need to be some guidelines that have to be implemented, perhaps punitive measures that should govern the rules for gatherings at home? Because, while people are still, reluctant to host large gatherings outside, some people have begun to do that at home.
So I do agree there has to be some rules, and we must have some ways to see that they are followed. But the most important thing is that everyone should have his own moral responsibility.
Right.
After all, by having a party at home or having a gathering at home, you are risking not only yourself, but your near and dear ones. And if you have a person who has infection out there, everyone or many people in that party will get infected, and that will be something that you will feel very guilty about. And some of them could get a very serious illness, land up in hospital, and be on a ventilator. So I think it's important to understand your responsibility when you organize such functions. There can be rules and regulations, but an individual's responsibility in such a situation becomes paramount.
Well, it's very crucial that you say that, and I hope that, more and more people who are listening to you actually implement some of that. Let's shift our focus to vaccine, because the Lancet study now says that prima facie it appears that the Russia vaccine is safe. Will there then be a vaccine perhaps sooner than anticipated?
So the Russian vaccine, the study which has come out in Lancet suggests two things. One is that it is safe. The side effects that they reported are minor in terms of local irritation, fever, body aches, and it does create good amount of immunogenicity. The only reason why people want more data is that the sample size is small. It's only around 70 to 80 patients or 70 to 80 volunteers.
Right.
So that's a small number. You will need to see it in a larger number to say that it's safe, and in people who have other comorbidities to say that it's all right. So I still feel you need to do a little bit more studies in terms of safety profile. For any vaccine, the most important thing is that it has to be safe. Safety is paramount. You can't start vaccinating a large number of people and have a vaccine which causes side effects. So we have to make sure that whatever means we use, the vaccine is safe, not only as far as the vaccine side effects are concerned, but when someone gets the COVID infection, the vaccine doesn't exacerbate the infection. It's known in certain vaccines in the past that vaccines can actually have an enhanced response, and the infection may become more serious once you get the similar infection. So those things have to be taken care of.
Well, very interesting to note the flip side of a vaccine and how it can in fact go wrong. The World Health Organization, on the other hand, has said that a vaccine is not expected until middle of next year. What, according to you, is a realistic time frame?
So it depends. If you do all the trials that have to be done, even if you compress them, it will take a few months, and that is what the WHO is trying to say. If you were to look at a few things, that is, you look at the safety and you say, okay, you have a vaccine which is very safe, and we are sure that it is not going to cause significant side effects. We are not that much concerned about how effective it is, and let's bring it to the market. Then you could cut down the time to some extent, but you're not sure how effective that vaccine is going to be when you vaccinate a large number of people. So I think if you want to do everything properly, that is, you need to have a vaccine. You need to see that it is immunogenic. It gives you a good amount of protection, and it also works in people with comorbidities. It gives good immunity to the elderly who are at a higher risk of getting serious infection, and it doesn't have significant long-term side effects. Then it's going to take at least till the beginning of next year or mid of next year.
And how soon, can one expect people in India to be inoculated with this vaccine, given our population, given now the proliferation of the disease in, rural India? What would you anticipate to be a realistic timeline?
So universal vaccination is going to take some time, maybe not, maybe more than a year or two. We
Right.
will have to have prioritization. We'll have to prioritize who are the people who need to be
Of
vaccinated
course,
first.
yes.
It could be those who are at a higher risk of getting the infection. It could be those who have a higher risk of getting a more serious infection, which can lead to increased mortality. So in the beginning, there's not going to be enough doses available to
Right.
vaccinate everyone, and therefore you will have to make a priority list. And depending on the doses that are available, go down that list, and you'll also have to develop a strategy of how do you distribute the vaccine
Right.
to the entire country, both the urban and the rural part, maintaining the cold chain and making sure that it's given properly even in the remotest part of the country.
Well, absolutely. Vaccine development is one question, and distribution, a whole different ball game altogether. We've talked about the fact that, there are many questions regarding antibodies, how long they last. Now, there's a recent study which says that not all those who recover from COVID-19 necessarily have antibodies. Is reinfection, Dr. Guleria, a real cause of concern?
So there have been some reports of reinfection which have been well documented. There was a scare of reinfection in the beginning of the pandemic from South Korea, but it was shown that this was not a reinfection. It was just viral shedding going on for a long period of time. But there are recent reports from Hong Kong and from Europe which suggest that some individuals can get reinfection. As of now, it doesn't seem to be a major problem, but it's a cause of concern because as the pandemic progresses and we have larger and larger number of people who have recovered and have recovered for quite some time, the question remains how long does the protection last? Does it only last for a few months or does it last for a year or two? And that has bearing on the vaccine also. So I think there is a lot of research going on to see whether the antibodies alone are the ones which tell you that there is a lack of immunity,
Right.
or you can also look at what we call cell-mediated immunity, T-cell immunity, and that may also be providing some degree of immunity, and therefore the chance of reinfection may be low. Currently, I think it's low, but
Right.
time will tell whether it becomes a serious problem or not.
Which actually brings me to my next question. The CT value, has been talked about a lot, is an important indicator of the severity of the virus. What is this CT value actually mean? How important is it? Could you break it down for our viewers?
So the CT value is the cycle threshold, and it's inversely related to the viral load.
Okay.
So if your CT value is low, that means you have a high viral load, and it's based on the RT-PCR test that you do.
Right.
So the CT value may vary from different kits also, and it's not a one standard value which can be used across the board. Now, initially it was felt that the CT value may give you two information. One is how much is the viral load and therefore how serious an illness can you get. And secondly, how infectious are you? What is the chance of you spreading the infection to others? And it was argued that if your CT value is high, that is if your viral load is low and a cutoff was taken around 25 to 30, then you are less infectious and you are likely to have a less severe disease. Right. However, data has not shown that to be true. It's been shown that people may have a different CT value, and it also depends when you are tested.
Right.
For example, if I got tested today, I had mild fever, but my viral load is still increasing, I may have a CT value which is high, suggesting that I have a low viral load. But tomorrow, if I got myself tested, my CT value will change. Okay. Because now the virus load has increased and my CT value will come down. So giving a CT value at one point in time doesn't really have much significance. I think we should just see whether you are positive or negative,
right,
and then monitor people like we usually do for oxygen saturation, for other symptoms, to decide upon the severity of disease.
All right. So interesting, because that value can actually vary. It's dynamic basis when it is in fact taken. Dr. Guleria, the other cause of concern has been post-COVID death rise. What should recovered patients really be careful about? This is emerging, as a very important question, and a lot of our viewers have asked about this.
So this is something which is now becoming a cause of concern, because as we move out from managing the acute part of COVID, we're now looking at the post-COVID sequelae or the chronic part. And now we're seeing that this is also something which we need to really address. This is happening because we know that COVID is a multi-system disease. It causes involvement of various organs. And sometimes when you recover, it leaves a scar or damage in these organs which can cause long-term problems. Right. For example, in the lungs, it can lead to fibrosis or scarring in the lungs, and therefore you become oxygen dependent. Many people then go home on oxygen, and if they walk a little bit, the saturation falls and they become breathless and require oxygen.
Right.
In some people, it can lead to what we call cardiomyopathy. The heart muscle becomes weak, and therefore, again, your ejection fraction or the functioning of the heart becomes weak, and therefore, it again causes breathing difficulty. There are some people who've had a clot in the brain, a stroke, which has also occurred as a part of COVID. So post-COVID rehabilitation has become important. It can have minor complaints. Some people just have fever, body ache. They're not able to concentrate. They feel very tired. Some have a little bit of mental problem. They are stressed out. They're not able to concentrate. And the stress of COVID has caused them some degree of psychological stress.
Right.
And others, of course, have a more serious problem. So we now need to start addressing this more seriously.
And how crucial is post-COVID care, Dr. Guleria, and what does it entail? What should a patient who has recovered from coronavirus, whether it's been a serious bout or a mild infection or even have been asymptomatic, what is it that they must absolutely do?
So I think post-COVID care is a mind-body healing that has to be done.
Right.
So a positive thinking, some degree of meditation and yoga is very important. You must do some exercise, especially breathing exercise to increase your lung capacity. Take a good amount of fresh fruits, green leafy vegetables, and have a normal, good, healthy diet.
Right.
Gradually start increasing your activities and take multivitamins and other supplements. And I think with that, there can be a good and faster recovery. And majority of people, I would say more than 90 to 95% of people who have had COVID will make a total and complete recovery.
All right, Dr. Guleria, thank you very much for being with us on the broadcast and sparing your time. As always, you've answered all our questions so very patiently. Thank you very much.
Thank you. Thank you very much.